The future is not like the Isle of Wight awaiting our arrival. The future is like Regent's Park, something we imagine, plan and build. If you don't imagine, plan and build the future, someone else will. Now the future of healthcare may look as though it's all set as a result of the bill and the reorganisation. But from a population perspective, there's a number of problems. The population size of most CCGs is too small to make sense for the optimum size of a system, for example for liver disease or for alcohol prevention or for rheumatoid arthritis or for cancer or for mental health. Secondly, the geographical boundaries of CCGs and local authorities aren't necessarily the right boundaries for the way in which care has been delivered sometimes since 1948 and probably will continue. So we need to take a new approach. And we need to look at a new approach to healthcare, one that's population based. One thing that will emerge from this reform is that the preoccupation with institutions like primary and secondary care will be complemented by a preoccupation with symptoms like depression or headache or pelvic pain, conditions like epilepsy or chronic obstructive pulmonary disease, and with populations like frail elderly people or young disabled people. We'll see matrix approaches, population-based integrated systems of care, and what a great opportunity for public health professionals. The work that we've commissioned from Solutions for Public Health from the Rightcare programme asks them to engage you to do a number of things. Firstly, to reach agreement on the shape of healthcare. Imagine, plan and build population-based healthcare. And many of you already have a lot of experience of this. So we need to harness and garner the knowledge from public health professionals. Secondly, we need to think what skills are needed. For example, are all public health professionals equally good in the skills of accountability for reasonableness? Do you know about the work of Norman and Daniels, for example? How familiar are you with the principle of optimality, first advanced by obeyed is done obedient? There's a knowledge and skills we need to identify, and then we need to identify the gap between where you are and where you need to be for this new world. And then, and this may appear the most radical, but to me it's the most commonsensical approach, we need to say, is the best approach to have everyone in little watertight departments? Because that's where we went wrong with primary care trusts. That we need to get not only the ability to look up the latest randomised controlled trial, but what Edwards Deming called profound knowledge. And that means some degree of specialisation and some degree of collaboration. There's a very interesting book just published called Wired for Culture by Mark Pagel. And he says that we succeed as human beings because we collaborate. So we'll also be looking at new business models. There's a consultation taking place. We'll be getting views from many of you, particularly the next generation. The future is yours. And then there'll be a conference in September, and there'll be the first national conference on better healthcare, public health, celebrating achievements and imagining, planning and building the future for public health approaches to healthcare. We look forward to working with you.